Hi, my name is Sarah and I am with Elsevier, and I get the privilege of sharing with you our SurePath Vantage platform. There's a lot of pieces to our SurePath Vantage platform. It's an active learning course that you would employ for the different courses within your curriculum. So I'm going to give you a quick snapshot of what that's going to look like, what it entails, and how this might be beneficial to your program. So let's get started. When you create your SurePath course, you're going to have a course plan, and in that course plan you're going to have lots of different tools that you can elicit. These tools can be pre-class assignments, post-class assignments, and in-class activity assignments as well. So you could bring up an empty EHR and have a clinical conversation with students and fill in a blank EHR. You can create unfolding case studies and have them do that as group activities in class. There are osmosis videos and other tools within here that give the students multiple opportunities to digest content. We know students learn in different ways, so this would be an osmosis video.
It creates a pulse.
So that gives you an idea of what an osmosis video looks like. But as you can see, there are lots of different ways that students are going to interact with content. There are ebooks here, there are quizzes that you can create that have both next-gen NCLEX and standard NCLEX item types in there. There are shadow health assignments, which we're going to get into. There's external links, and then there's also lessons that you can involve students in. All of these are different ways for the students to see and access content and hopefully find multiple ways that work with them to help them retain this information. But what I want to focus on is the inclusion of shadow health. So as you're seeing here, all the content resources you can add, under the clinical resources is shadow health. And in each SurePath Vantage, there are a handful of shadow health assignments that can be brought either into the classroom, assigned pre-class or post-class, and they're great ways for students to have a standardized patient experience that also give you an opportunity to focus on DEI kind of principles and social determinants of health, things that are important that they may not always get in a routine clinical experience that you are setting them up with. I'm going to bring you over to a pediatric patient. This pediatric patient, he had a fall. So we've already introduced the student, or introduced ourselves to the student, and we're actually in the middle of a conversation with this patient. So we can do lots of different things here, but the whole point of shadow health is helping the students to develop their therapeutic communication skills. So I'm here with the student, and I'm going to ask a question. Were you wearing a helmet when you fell? Now, I could talk to Tim, which is his father. Do you encourage Damien to wear a helmet?
I tell him to always wear it. Obviously, we wouldn't be here if he did. I don't know how often he wears a helmet, if ever.
And I can ask another question. I can talk to Damien, and I can ask him, on a scale of 1 to 10, what is your pain?
5 out of 10. Right in that sweet spot of ouch.
Now I can empathize with the patient and say, I'm sorry that you're still having pain. We'll see what we can do about that.
Thanks, nurse.
I also have the opportunity to educate as well. So as I'm helping the student, or as I'm helping this patient through whatever that issue is, I can educate them on the importance now of wearing a helmet, because obviously this patient wasn't doing so when they fell. I have the ability to inspect, and if I wanted to look at the patient's head, it'll give me the opportunity to actually see the wound and what's going on. And based on that, I'm going to be filling out the EHR and letting them know what I'm seeing. So I'm seeing laceration, or I'm seeing, swelling, so on and so forth. And I'm going to go down and I'm going to do an inspection. I can inspect the rest of the body as well. I can look at any of the EHR orders, documentation, flow sheets. I can go back to my main menu, and I can also do other things like oscillate. So I can listen to breath sounds of the patient, and I can listen. So as I'm going through and actually treating this patient, I'm going to continue to fill out information in the EHR, ask, educate, and empathize throughout to practice what being a nurse is really like. And then at the end, when I submit, I'm going to get a score. This is an overall score for a cohort. So this is going to show you how your student is performing overall as a cohort, and objectives collection, subjective collection, empathy, and care planning. And I'll get lots of information on the dashboard that gives me an idea of where my students are, but I can also see how that student did on that individual assignment as well. And when I look at that and I see how the students are performing overall, I can see if there's a challenge for them in education or in empathy, or I can pull a transcript from specific student experiences and see where their communication skills might need some help, so that we can coach them and hopefully help students feel more comfortable with that meeting that patient face-to-face for the first time. So that gives you an idea of SurePath Vantage and all the assets that are involved in it. All of these assets can be sold individually as well. We also have a full clinical solution as well as a full 360 program solution that we offer. Please make sure that you reach out to your reps as soon as possible to get more information on any of these products. Thank you.